Hi everyone, this is Vivi. It's been a while since my last reading blog because I've been really slow in reading books in the last month or so. I just started a new job earlier this month, and all my time after work hours I spent on reading these, like all the printouts. But I did finish a book last week. It's called Praying for Emily. I finished this book in 3 days, or technically it's 3 nights. So last week was the spring break, and I took my son to Hershey Park for 3 days. And I read this book each night after we came back from the park to the hotel and finished it within 3 nights. I also intentionally brought this book for our trip to Hershey Park because the girl, Emily, who's the little girl like, on the swing on the cover. She is the first kid ever in the whole world who received the CAR T therapy, which was an experimental therapy back then. She had a very, very aggressive type of leukemia, which is called ALL, and she received most of her care or treatment, cancer treatment, prior to CAR T in Hershey Medical Center, which is basically 10 minutes away from Hershey Park. Prior to receiving CAR T, Emily has exhausted all the other options. So she went through the chemotherapy, the standard of care at that time, and then she went through very, very intensive like combo chemo regimens, which knock out her immune system. And she relapsed again and again and again. So the family was desperate. And after the refractory relapse, so refractory relapse refers to the disease comes back again and somehow the patient stops responding to the treatment. So the care team at the Hershey Medical Center basically told Emily's parents, the only hope you have now is stem cell transplant. That means you need to find a matching donor. And fortunately, the parents and the care team found the matching donor, but unfortunately, the donor kind of like had the cold feet in the last minute. And the donor kept postponing the procedure, and then Emily really ran out of time. Because the stem cell transplant never happened, now everyone from the care team was telling the parents, you should just take Emily home or take her to hospice care. But Tom, who is Emily's father, just didn't give up, and then he reached out to CHOP, which stands for Children's Hospital of Philadelphia. And one doctor from CHOP told Tom the CAR T, which was the new innovative experimental treatment for leukemia, happened to have the trial open. So they enrolled Emily on the CAR T trial. But at that time, CAR T was so new and it was never given to a pediatric patient. So people at that time didn't really know what's going to happen. CAR T therapy, at least as of now, is a very individualized therapy. It means the CAR T therapy is produced only for that individual, very specific patient, and then it cannot be used for someone else. So the providers take blood from the patient and then goes through a process called apheresis. Basically, it's a process to separate the T cell from the blood, and then the manufacturer of the CAR T therapy engineer the T cell. The engineered T cells then become the cancer fighters, and these T cells are then infused back to the patient's body to fight cancer. After receiving the CAR T therapy, Emily experienced a really, really bad side effect, which is called cytokine release syndrome. So it means your immune system has become so overactive that it starts to hurt yourself. And the doctors had to put Emily into medical-induced coma for almost 2 weeks. And during that 2 weeks, everybody, except for Tom, Emily's dad, believe she's not going to make it. She's going to die. But one of the doctors on Emily's care team proposed using tocilizumab, which is approved for treating rheumatoid arthritis, not for treating any CAR T side effects, because the doctor found elevated IL-6 level in Emily's blood. And IL-6 is a protein that's usually seen in rheumatoid arthritis patients. After receiving tocilizumab, Emily surprised everyone, including the most well-known researchers in the space. After only 20-ish days of receiving her CAR T therapy, she was declared cancer-free, so no cancer was found in her body. This is an amazing story of a strong little girl who's so brave to fight cancer. This is an amazing story about two loving parents. By the way, Emily is their only daughter, only kid, who never give up. And this is also an amazing story about scientific advancement. And Emily is really the one who brought this amazing therapy to more people and brought hope to more families. In my new job, I will be working on new CAR T therapy, and this book, the story, just inspired me so much. Nowadays, the CAR T therapy is mainly being used in treating blood cancer, but there are a lot of people who are trying to expand CAR T into solid tumors. And I personally firmly believe that using CAR T in solid tumors will become a reality. Alright, so that's today's vlog about this book, Praying for Emily, the first pediatric patient who has ever received CAR T in the whole world and changed the medical history. Alright, see ya.